Good afternoon and a very warm welcome to all of you. I love that jingle, especially when they get it right as we're walking through. It's like doing a catwalk show, really, and all the speakers could have been, oh my God. But it's our local jingle. It's our homemade jingle by our members of staff using AI, nonetheless. And those of you who come again, you'll hopefully recognise it and start wanting to kind of beat to it. My name is Dharmendra Kanani. I'm the Chief Operating Officer and Chief Spokesperson at Friends of Europe. It's a very pleasure to welcome you here warmly on this dull grey day in Brussels. Yet it's a bit of monsoon fever and weather. As you know, climate is changing rapidly, so we're experiencing things that the other parts of the world were not experiencing in certain ways. So we're here today to talk about, as it says, healthy ageing for Europe's future and the role of immunisation. And most of you know this. Those of you who are here will be present and know that actually we have got a fantastically ageing population. People talk about it in a negative way. It doesn't have to be that way. But we will have nearly, 40 to 50% of the population in about 10 years' time will be over 50, for example. And we know that with ageing, there are a number of constraints, conditions, contexts that we need to be thinking about in terms of how we're ready for infrastructure for an ageing population in Europe. Are we really clear about what the immunisation trajectory should be for aging, for older people? What we do know is that in the context of both pre-COVID and post-COVID, suddenly you had all the misinformation about immunisation of kids, and suddenly kids weren't being immunised. We knew that people thought that actually the vaccines during COVID were a bit dodgy, depending on what you read. And now we know that as people live longer, we do need to make sure we top up, but also actually, in the first instance, make sure our children, our adults, and our older communities are sufficiently inoculated. At the heart of this debate, really, if you think about it deeply, and this is the conversation and debate we want to have with you, it's about prevention and well-being. It's about prevention and well-being. If we were to make sure that we got our culture and mindset and behaviours around a prevention mindset, immunisation wouldn't be an issue. It would mean that people would be living better, healthier, well-being lives. Also, what we do know is that if we did do that more effectively and had prevention, imagine if you had prevention as the public policy objective of healthcare systems and health. If you did have prevention as a public policy objective for healthcare, imagine the billions we would save in costs. We know that we have the data on that, and we absolutely know that prevention is better than cure. So, on that note, we have a fantastic panel of contributors. Just like you come to any other Friends of Europe debate, it is multi-stakeholder and it's multidiscipline. We have the private sector, we have an academic, we have someone from the parliament, and we have someone from academia, as I said. So we have an interesting panel, and we have someone who is going to hopefully focus on an issue that we don't readily think about when you think about immunisation, and that's about gender and women. And so it's really good that we've got one speaker online also. So hopefully you'll get an interesting mix of contributions. But as I always say at our events, please don't be passengers and voyeurs. You're here, that 90 minutes of your life you're not going to get back, so engage with us in this and make it the best debate, because we firmly believe that, in terms of policy thinking and policy making, it has to be a collective approach to policy thinking and making, which is both multidisciplinary and multisectoral. And you are the brains also in this room, not just here. So if you don't speak, I'll just come and pick on you, and hopefully you won't get too embarrassed. Okay, without further ado, I want to introduce Susie. Susie is a top gun at GSK, has worked mostly all over the world in various parts actually, and you've been a doctor. So she's been a GP, and she's introduced vaccines in different parts of the world. So it's a great opportunity to listen to someone who's done those various things and brings a different perspective, if you like. What do you think is the role of life sciences on this agenda at the moment in terms of how we promote vaccinations and, I suppose, change attitudes, but more importantly, what's the role of life sciences in this territory?
I think you've mentioned some of my key points already. Let's get the microphone. Can you hear me okay? So thank you very much for having me, first of all. I'm really delighted to be here. I'm delighted to hear what the chat in the audience is, but also to learn from my fellow panellists. In terms of life sciences, I think we just go back to just setting the scene on the ageing population in Europe. We know, I think globally, we've just surpassed more people over the age of 60 than there are under the age of 5 now, which I think is a quite fascinating fact. And we know that projections in Europe, we're going to reach a third of the population by 2050. So this is quite significant. And we know that when we retire, 2 or 3 or 4 decades, sometimes we're reaching, and our life expectancy is getting longer. So we've got to think about not just life expectancy, but what that life looks like, that healthy life years, the well-being, and that's really what we've got to think about. So, in terms of what life sciences' role has to play, there's so much research and understanding what ageing does to us, and like everything, as we get older, our immune system wanes and it weakens, and it makes us much more susceptible to vaccine-preventable diseases. It makes us much more susceptible, as we know, to then the complications of those. So, as well as that, as 60% of people above the age of 65 in Europe also have another comorbidity. So as we get older, there's more and more risk factors for us to being susceptible to these vaccines-preventable diseases. And that doesn't just increase the risk of premature death. It really increases the risk of morbidities, frailty, loss of independence. So the impact not only on the healthcare sector, but on society is huge, because if we think about the older age group, I think it's in Europe, something like the GDP is 8% of the GDP is from the older age group. So significant burden. Not only that our vaccine preventable diseases increase our risk of other important sequelae, so cardiovascular risks, neurological risks. So if you add that all up, the burden is really huge. So from a life sciences perspective, there's a lot we can do, because as our cultures are focused on treating disease. And we're really good at treating disease to expand life expectancy, but ironically, we're really rubbish at the modifiable risk factors such as obesity, drinking, smoking. So we've got to think quite holistically. So right now, and obviously vaccines is a really massive part of that in terms of preventing preventable diseases. And life sciences approach to that in Vaccines Europe membership, the portfolio of vaccine candidates at the moment is over 100, and 80% of those are for adults. We're really good at pediatric vaccines, as you said. So in terms of adult vaccinations, I think we are seeing vaccines now that didn't exist for conditions that we've just not seen before. We've also got vaccines that are better than we've seen before. And focusing on, if we think about the triple-demic a couple of years ago, in the last couple of seasons, we've seen RSV, we've seen influenza, we've seen COVID on top of the pneumonia. So we've got a lot to do to make sure we protect our citizens and protect them from those, not only the diseases, but the complications of these diseases. So we've got vaccines that are combinations for addressing the various respiratory diseases that we see. We've also got vaccines that are addressing antibiotic-resistant bacteria. So there's the AMR side of things as well. And we're getting better, actually, as industry at looking at new technologies. There's a lot of science and data at our fingertips to be able to understand where we can focus next, because it's not just about bringing Me Too vaccines onto the market. It's absolutely about those vaccines that add value, and also making sure that we are helping support with infrastructure and in terms of accessibility and pricing of vaccines.
Thank you. What about then, given those challenges you set out, but also pointing to some very significant data points, right? Both in terms of the kind of potential for economics, but also planning, I suppose, societal infrastructure. What do we need to do? What kind of do you think we have the right policies in place? And do we have the right kind of public-private partnership? You are a major partner right out there. What do you think needs to change for the better, potentially, in terms of making sure the challenge you've set out can be more readily met by having a more of a collaborative approach between public and private sector?
Yeah. So I think certainly times like this, coming together with all of the areas of all the sectors coming together to discuss is a really important start. I think you pointed out your 10 policy document yesterday, which is about improving social care, and that includes private, just an advertisement for Friends of Europe here. So I think I would split this up into 4 key things. Is firstly understanding that the cost of doing nothing is high. We know that there is an implication on population and people's health, the healthcare sector in terms of direct costs, but also the indirect costs of the burden increasing. So socioeconomic factors, understanding that this is going to get worse as we get older, we have more people who are older, focusing on better health years lived when we are getting older is really important. So the cost of doing nothing is incredibly high. Next is looking at the evidence of vaccines programs and why they are impactful. So there's a couple of reports recently. So the Office of Health Economics showed that an investment gets a 19 times return on that initial investment with adult vaccination. And that's beyond the direct healthcare costs. That's on society in general if you kind of monetize all the sequential benefits. Then most recently with the think tank Ambrosetti came out with a report that's showing preventative health strategies, immunisation. It has not only an improvement of our life expectancy and quality of life, which is what we're looking for, but it also has quite significant economic benefits, healthcare system benefits, but also improves the resilience of countries in terms of the socio-economic factors. And I think that showed a return of, for every €1, you get a 14 euro return in terms of societal costs. So there's evidence. So the cost of doing nothing is too high. We know that there's evidence that shows that immunisation is good. It's also then understanding what the barriers are out there. At the moment in Europe, we know that countries spend less than 0.5% of their vaccination, of their healthcare costs on vaccination. If you think that adult vaccination really is a small part of that pie, we've got a lot of work to do. Not only that, if you look at all of the countries around Europe, there's quite a big disparity in terms of the number of vaccines available and the schedules, but also access to those vaccines. Sometimes it can take years to provide access and reimbursement to those vaccines. So on top of that, there's just general infrastructure, vaccines hesitancy, vaccines fatigue, they're all the barriers. So for me, I would say the last thing, the 4th thing is invest with intent. And by that, I mean that prevention strategies, vaccination should be seen as an investment, not a cost, for all the reasons I've kind of highlighted. That means understanding how to to invest in the right infrastructure and programs for vaccines to make sure that we have equitable access, to make sure that we are having the right vaccinators, the right point of access for vaccines. You know, it's not just about clinics and doctors' clinics and hospitals, it's about pharmacies. So there's so many ways that we can actually get vaccines to people. And vaccinations on their own from industry are not going to work unless all of this infrastructure is in place and people have that access and they've got the right then education. The other investment, is in it's in public health awareness and it's in education for HCPs and the population, because we know that with vaccines fatigue, COVID was a really long and tumultuous crisis for all of us. Nobody was not impacted. Understandably, there's an element, we've had lots of great learnings, but there is an element of fatigue, and we need people to understand really not only the consequences of these vaccines, preventable diseases, but why vaccines can help, and really why not to be scared of them. So I think there's a number of things that need to be invested in. I could talk more, but I'm
no, it's really helpful. I'll bring you back in because I was just thinking that I mean, I don't know how about you guys, but you know, in our office, this is not to scare you because they're not here in the office. We've had about 5 or 7 people in the past 10 days just blown out by COVID symptoms. Yet there's no public health awareness happening. We've got nothing on TV. No one's being told to top anything up, and there you go. And it's just amazing. You can see it. There's a family in the UK. It's a wave, but public health is silent on the matter.
And we are just heading into the season again. We're going to see RSV, we're going to see flu, and we're going to see COVID. I've heard loads of people with COVID symptoms recently, and so there's a real risk, while there's fatigue, there's a real risk for us to just, sweep it back under the carpet.
Absolutely.
We've finished the pandemic. We haven't finished. It's now in an endemic stage, and it's going to be coming back every year, and we need to understand. And that's why the work that industry is doing in looking at new technologies and understanding how we can use things like combination vaccines can help with that. But it won't, again, help. Developing manufacturing vaccines is not going to help unless people understand why they're important and there is the infrastructure.
Indeed. Thank you very much, Susie. And please, you can sit. You don't have to stand. Just because I'm standing.
From the behavior point of your lifestyle.
It gives me great pleasure to introduce Vytenis. Vytenis is someone who's a seasoned politician and is on the subcommittee, on, as we say, on public health. And we're really pleased to have you because you've been around the block in terms of understanding how Parliament and how the differences amongst member states, but also how the public policy community, namely the Commission and the Parliament, behave on this agenda. From your perspective, right, what needs to happen in terms of, let's say, a priority or the kind of, you've got a new mandate starting. What should be the priority in this context? Vytenis, over to you.
Very difficult question when I'm speaking about priorities. Look, healthy aging for Europe. I am one of aging population, I am 73. And I am
wow, you don't look...
Yes,
wow. We need to have your diet.
The voters elected me now to the European Parliament. In previous term, I was WHO Special Envoy for universal health coverage. And vaccine uptake was one of my topics in 53 European regional countries. But let's start with this question. I am doing every year one important step. I am vaccinating myself against influenza every year. Please raise your hands who are doing the same. Look.
Wow, that's very good.
One of the priorities. It's one of the priorities here in this room, colleagues. Don't speak about high sky, We need to speak about concretely what is on the ground. And of course, you know very well that uptake of vaccines is going down, especially in the area of children. About what we are speaking now. Of course, I know very well that one of the main concerns of WHO level is to provide life course immunization. Life course. It means from start till the end. I am vaccinating myself every year. I take a lot of vaccines because I was in Africa, in the area of Ebola. I visited different countries where a lot of infectious diseases were around me. I vaccinated. I have 2 passports of international regulation passports. That's a certificate. I propose those certificates, please use it. And when COVID came into EU, which country reminds, sorry, we have in our hands vaccination certificates. Do you all have those certificates as passports? Where we are. But please look into agenda. European WHO proposed European Immunization Agenda 2030, where point 7 is strategic priorities for the European immunization, life course immunization. Please ask our governments, our ministers, our members of national parliaments, do they know something about such priority? You know very well. In this room all. But we are so weak in dissemination of those ideas. Of course, you know that looking into EU, into each member state, you can find different vaccination calendars. You know very well that now we have in the single market about 162 million people who are working in one country, in another, with their children, with their families. And then going from one country to another, in one country is too early to vaccinate, in another too late. And they are in the middle, in the gap. When they propose as commissioner, look, can we introduce electronic child vaccination card? Because we need to collect data and we need to how it looks in practice. All countries were against. A lot of countries were against. Why? They are arguing, no, it's national competence. This is national competence. But when COVID struck us, Then all forgot it about national competence. All tried to say, oh, sorry, Mamma Mia, what can you do? You please help, please commission help, please buy, vaccines, please organize joint procurement agreement. We did it in our mandate. But then we had no chance to achieve, common sense because it's on a voluntary basis. We decided to buy vaccines against TB. And in the beginning, I asked all member states, are you ready to join us and to share your money and can organize joint procurement? In the beginning, we received answer from 12 countries, then from 18, and then we started to write joint procurement agreement. Some countries got out of this agreement. And you have no chance to finish it because it's on voluntary basis. Why am I arguing about this very important challenge? Health is not as an aim in the EU. Health at EU level is only ancillary issue and only small line on public health threats, cross-border public health, allows us to first of all, to have decision on cross-border healthcare threats. Now we have regulation on cross-border. But of course, now we have HERA, now we strengthen the CDC, we strengthen EMA, but it is not enough. But it is not enough. We need to much more effective mechanisms at all levels, local, national, and European. Why I am arguing about European Health Union as true European, genuinely, with shared competencies in some areas where all levels should be involved to participate, to coordinate, and to achieve more progress, more results. You are friends of Europe. Please look how many now voters are voting in favor against friends of Europe. But you just asked me why we have such different picture in immunization decline. Please look into Trump. Can you see around us? And now in the European Parliament, you have a lot of members of European Parliament who are arguing about side effect, about that we are in hands of big pharma. I am in hands of big pharma because now GSK now is organizing, paying money, providing new vaccines. I am vaccinating myself, and the budget is paying money. Conspiracy theories are around us. Misinformation, disinformation, fake news affecting our efforts to provide real understanding about necessity to have a life course immunization. Life course. Now let's speak not about life course, and about children immunization. This is a difficult situation. If you look at the mission letter to the new European Commission,
yes.
You can find IMR, but you have no one word about immunization. Now, what about immunization? What about possibilities to harmonize national vaccination calendars and also to see some minimum standards where we need to use the same vaccines in all 27, vaccinating children, for example, or vaccinating some those who are traveling from one country to another. This is really, we are facing a lot of difficulties in front of us. And of course, sorry for being a little bit emotional.
No, we love your passion.
But
It's nice.
But it's pain in my heart.
It's time. We need this passion.
Because I am arguing always. But I can ready to show my example. I am vaccinating myself every year. I will do it openly. As UN Commissioner, I did it openly with pictures, putting pictures on the Facebook, asking all colleagues to do the same. And of course, because we were ready to promote life course immunization. Now I'm in the mission board of vaccination. And my excellent friend, Walter Ricciardi, you know him very well. He proposed mission-driving initiative on vaccination.
Yeah.
But let's see how can encourage European Parliament, European Commission, and Council to think about a little bit.
Okay.
Because it's about life.
It is. Vitalis, firstly, thank you for your passion and energy. Honestly, thank goodness that we've got people like you around. And you've made some really interesting suggestions in terms of, she really wants you to sit down, doesn't she? It's like, Big Chief, she wants to stand, let her stand. Stop controlling from over there, please. Shh. Anyway, so we were saying that, you came up with this, why can't we have a standardized calendar approach, etc. what we know about human nature, all of us, when adversity hits, we suddenly can become, able to do things that we didn't think we could do, like COVID. So suddenly we were all collaborating, and there was a kind of a sense of a European community working to do something. And it seems that we've forgot those lessons. You're a parliamentarian. You've been around in there, right? It's great what you're saying, but what role will you play and other like-minded parliamentarians do to raise the agenda of life-course immunisation? What are you planning to do?
I can be more than happy to invite you into Parliament with me together and to see how we can discuss vaccination topics in ENVI committee. I am now in ENVI committee and SAN subcommittee. And you can find maybe 1/3 of members who are arguing against. And they are, only one way is now to organize much more public debates, inviting experts, inviting, and also inviting people who saved their lives because of they vaccinated themselves. This is the best example to show real efforts of vaccination. And then when you see some examples, it's much easier to speak with those, members of our parliament. Of course, also at national parliament level, also the same. We need to keep in our hands a lot of good examples, positive. It is better than those concrete people will speak, will send message, and will present their cases. And then it can help a little bit to fight against vaccine hesitancy. Vaccine hesitancy is really a challenging issue. Why? Because vaccine saved our lives, and now results are that our very, like to say, safe conditions worked against vaccination. It's paradox.
No, it is. But there are some simple things you can do. Parliamentarians can be quite powerful. If you were to bring in, let's say, 500 doctors from across Europe and say, in front of the committee, this is what's going on, this is the experience we're having, this is what's happening to kids, etc. You could actually do things which are going to kind of, I suppose, create a bit of drama and shock, but actually bring practitioners into the system that will tell you and argue the case that you're making, basically. But I don't think we do, and this is not a criticism of you, I don't think we do that kind of thing enough, is to bring, actual frontline practitioners from hospitals and general practitioners into the parliament by a seismic number and say, if you're not going to do this properly, this is a cost to you, but also to the system. But I leave it at that for the moment. I'll bring you back in a second. But I want to get reactions from you in the room in terms of what you've heard. Your views, do you agree, disagree? Do you have an alternative? Do you have anything to say on the topic? Sir, we have a mic. Please do introduce yourself.
I'm Barry Oman, Executive Director of European Specialist Nurses Organization. Just a short comment. You just said 500 doctors and practitioners. Stop. I think our organization has vaccines at top of the agenda, creating a curriculum, and there's much going on. Only the big challenges is, I think, just to make the bridge between what you say, Jessica. We did so much until the provider and the society. So we have to cross this bridge, and I agree that we need to do more speaking, that we have more collaboration, but also be there.
But from your perspective, are you invited in enough on these conversations in policy community? What kind of, are you brought in only at moments of catastrophe, or do you have a regular dialogue with policymakers, both at the Parliament and the Commission?
There's a big learning curve because, as you said, instantly, doctors. And that's also a bit of the pain of a lot of other health professionals who just don't belong here.
Yeah.
And that's also a bit, so we try to do, to be engaged as much as possible with all kinds of alliances, but also a part of the coalition on vaccination. So we do as much as possible, but then it's also the other part, just to reach out and not asking us just to come in. So it has to come from two sides. But I think we're making big steps.
Okay, let's hope you're making big steps in a speedy way, because I'm not sure we've got a lot of time for this agenda, unfortunately. Anybody else? Oh, great. Lady there in the white jacket, and then lady there. Please introduce yourself.
Hi, I'm the lady in the white jacket. No jokes. My name is Charlotte from Redcare Pharmacy, Europe's leading online pharmacy. I have a question also for Mr. Andriukaitis. I really like the idea by saying that health should become a shared competence at least. If you would have to give a percentage, how big would you estimate the chance that within the coming 5 years it can indeed become a shared competence? Thank you very much.
And do you believe...
Can I respond immediately?
Okay, go on.
But it's very, because the question is straight to the point. First of all, you know very well that it was organized Conference on the Future of Europe. You remember. In this conference, our citizens raised issues about health also. Health was one of the 10 baskets. And they proposed 10 points to be introduced into Lisbon Treaty. Otherwise, we have no chance to. Second, as you know, we edited a book, European Health Union, Blueprint for Generations. Please look into this book. Not so big book, about 375 pages. You can read it. And we proposed also, concretely proposal of how can we improve Lisbon Treaty, proposing amendments. And those amendments were done by my colleagues, by Europeans, professors of law. And we have amendments really based on Conference of the Future. First topic. European Parliament in November 2023 proposed a resolution to Council that now we need to go into the way to rewrite or to amend Lisbon treaties. Otherwise, European Union has very, very difficult future. And Franco-German team also proposed topics why we need to change institutional frame of the EU. Otherwise, unanimity will kill all of us. And finally, Council decided this year to put it on hold. Yes, they are rethinking now in which way they can do. But my answer is to your question. We have only 2.5 years to press very much, to say very openly to all citizens, to all. We are in crossroads and we are facing very difficult picture in the future. If we are not capable to deliver our promises, to amend Lisbon treaties, not only because of health, because of a lot of composition should be changed, but health should be enshrined into preamble of the treaty as an aim of the EU. I am speaking about health and well-being union, and we propose enshrined it into the aim. Because in the aim now you have single market and customs union, economic and monetary union, and defense and security union. 3 unions. Now you are using word European Health Union, but it's misleading word because it's not union, because you have nothing in shared competences, only small line. And it means we have 2.5 years to organize, to trigger debates with you, friends of Europe. Let's raise your voice for all partners. Let's discuss, let's encourage national parliaments to debate issues about a future of European project. And we have only 2.5 years. After, it will be too late.
Why 2.5 years? Just explain. See, lady in white jacket, what you've created? There you go.
I am ready to do my best. Please help me.
But why 2.5 years? Why only 2.5 years? You said only 2.5 years.
Yes, because after 2.5 years, we do the second part, and we will go into finish of our mandate, and then you can see only business as usual.
Okay.
Now
so it's
we
political.
have good opportunity
Thank
to be
you very much.
active and to propose agenda and to press very much and to achieve something. Otherwise, it will go down. And then you see new parliamentary elections, new campaign, and it will be very, of course, keeping in mind enlargement. Keeping about 10 new members who are knocking on doors of the EU, 10 new. And very small one, Ukraine. Not so big one, Serbia. Very controversial countries, yes, but we need to say, yes, we can invite them into, how can we invite them based on our old mechanisms which are enshrined in Lisbon Treaty. And health should be here as an aim, as a hook, and a very positive signal to our citizens. because citizens are very worried about health. They are less worried about competitiveness and investment. They are less worried about Draghi report. They are much more worried about health, about Enrico Letta report, and of course about possibility to strengthen access to treatment, access to vaccination, fight against cancer. For me, it's very easy. I will be more than happy be one of the European citizens fighting in favor to promote health and to enshrine it into treaty. I have only 2.5 years.
Thank you very much, Dennis. Thank you very, very much for, again, that passion, but also thoughtfulness. In fact, also letting us know, and some of us obviously already know, that the system is ready for it, actually. The infrastructure is there, and we know what the actual solutions are for amending the kind of founding treaty of the EU and how we can make it. But it's as politics as ever that gets in the way. Your question, please.
Thank you.
Elaine
Cruikshanks from Acumen Public Affairs. I wanted to deal with the institutions as they are, imperfect as they are. There is a WHO resolution, which is now in its 15th anniversary, which says that member states have undertaken to actually, well, it's the council conclusions that were agreed amongst the Council of Ministers, that member states are going to get a 75% target of all over 65s vaccination of flu. And Vaccines Europe, where GSK is a member, has extended that to all respiratory diseases post-COVID, and with other great vaccines coming out for other diseases like RSV. I wanted to, hesitate, but I wanted to make sure that the political class, like the parliamentarians, who can raise a voice about this and bring the member states to account, actually do that. Because that is something that's there, they've undertaken to do. And the other thing I would just throw in order to enable that, we found with COVID, having the figures about levels of disease, levels of vaccination, etc., helped enormously, because when you measure it, you do something about it. And if we could get member states also to submit figures in the same way every year to ECDC, then that would be a great step forward on all those diseases, COVID, flu, and RSV.
But you keep hold of the mic. I want to get a sense of what your perspective is on the likelihood of the question, the answer to the question you're asking at the moment, right? And because, let me just present it in this way. Isn't it startling that the second mandate of a president that was kicked in the teeth with their biggest world pandemic, right? And actually totally, within months, imagine, changed your priorities, but also had to work in a different way. And then we have an energy crisis and a war, etc. That health is not mentioned in big letters at all. That it's not in the conversation. But the president was overseeing the biggest crisis we've ever had in the world on health.
Well, but welcome to political realities. I mean, the train moves on. And Ukraine and the war situation, the geopolitical situation has really taken over. It doesn't mean that we shouldn't keep raising our voices about it, because the AMR, just to take that one example, is one that's waiting to happen. And it won't be 10 or 15 years.
No.
The pandemics are getting more regular as well. So I think the only thing we can do as politicians, as political class, is to raise the voice on things that I think are a good deal more achievable, sorry, Mr. Andriukaitis, than changing the treaties, which is keeping the member states to account on what they've undertaken to do already.
Great, thank you very much. Anybody else?
May I add a little bit about IMR? You know how it is difficult to achieve global pandemic treaty because IMR is global threat, not European one. It's global. Yes, and look, and a being commissioner proposed, look, maybe we can have good opportunity to sign like tobacco convention, to sign convention on IMR only in 2 points. To have globally the one methodology, doing with some pathogens, and of course, global network of laboratories, accredited laboratories. It would be good to monitor situation around the globe. Very few points, and we didn't achieve no results. And it is not only because member states, but because a lot of in different countries are a lot of arguments against this. This is not only a question about accountability of member states.
Okay.
It's a very difficult question for all of us.
Great, thank you very much. I'm going to move on to our next two contributors. Pierre, thank you for joining us. I love this. Vaccinopolis. Centre for. You're a you are a professor in vaccinology, and you've done a lot in terms of contributing to the learning that we've all benefited from in various ways, and you've connected also with other practitioners elsewhere. Given where we find ourselves right now, what do you think needs to happen in terms of strategy to improve our lot, to change things for the better? I mean, aren't you surprised that... That's a terrible way of leading question. Are you surprised at all by the fact that we're seeing an increase in COVID infection rates? I'm not sure whether this is just my gut reaction, but it seems very clear that there is a wave coming. If we just take our little community here as an example, and given there is no public health dimension to this right now, it's like we're waiting for the numbers to increase, but generally because we're not measuring it anymore in the same way, we just don't know. But if you use this context just to think about what can we do in terms of strategies to improve the mindset and the approach we have currently. A difficult question, I know.
Well, I was really wondering what kind of question you would ask after all we heard so far. But if I was listening, and that's part of the answer, I hear more, larger, longer, and it's all about that proportion of the population of adults and elderly. And if you look at it from a point of view of a pathogen, of a virus, in fact they like it, because the target is becoming bigger. You have a larger proportion of the population that is vulnerable, that is getting older, that has comorbidities, that is not well protected. So, from a point of view of a pathogen, it is the announcement, really, of the next epidemic. And we all know that. And we do nothing. We are not able to convince our healthcare providers at a very large definition, and I fully agree with that, but we are not able neither to convince that target population. So the question is, what have we learned from COVID? Or what have we forgotten? And I think, unfortunately, we have to put the emphasis on forgotten. And what we should have learned is that without any intervention like a vaccine, the hospitals were overcrowded, people were dying, and we were in fact very vulnerable as a society. And vaccines made a difference. And that's what some people remember, in particular the older people. They know that with the vaccine they were protected, not completely, but at least they would not end up in the hospital. And that's still true today, but we don't repeat that message. And that's a pity, because we know it has an added value. And we have really to convince society, policymakers, but also the healthcare providers, that this is the best choice we can make. One of the problems is, and I think it has been raised also in the audience, or you used the word access. Free access to vaccines like we do for the infants, and we know it works, and it can guarantee still a very high coverage. We do have well baby clinics. We don't have well adult clinics. We target adults, elderly, completely individually, like we do it for a curative intervention, which is completely wrong. This is public health. We should target the whole age group. So we have to change our healthcare system so that the access to vaccines is very easy, is very low threshold, as we did with COVID-19. We built all kinds of vaccination centers in a lot of places in the UK, in Europe, and it worked. Strange enough, it worked, it was a success. And we fully forget about that. So today we should again think about how can we easily offer the vaccine. I got an invitation for my COVID vaccine at my hospital on November 7. I'm sorry, but that's too late. We are in the middle of a wave. Makes no sense. By that time, I know what kind of questions we will all ask. I just got COVID, when can I get my vaccine? Probably 4 months later. So that's crazy. So we need to have really a tailored system to reach adults, to inform adults, to communicate, to avoid all the fake news. So we have to invest really on a collaboration between nurses, midwives, GPs, pharmacists, pharmacists can reach a lot of people, you know.
Oh, absolutely.
The threshold is 0. You can enter a pharmacy at any time. You don't need an appointment. And we really used to use that manpower all over Europe. And that's really where we have to build a structure, very well connected, so that a vaccine that is offered is immediately in a database so that everyone knows it. Also the treating physician knows it. If a nurse offers the vaccine through an occupational health department, it should appear in the same database. So that connection is tremendously important. And the second thing, and those who know me will know what the second thing is, we have to train our future generation of healthcare providers and current generation of healthcare providers much more into public health and vaccinology. And Gerrit Hendricks, who is in the room, did a survey in Europe. And what came out of that survey, all the healthcare providers are eager to learn more. They receive questions they cannot answer, and they receive a lot of questions on vaccines. And if they cannot answer what happens, people go to Google. And you know what happens when they go to Google. This is not very supportive for vaccinology, I think. So we have to change this system, and they should go to the healthcare provider because they are well trained. Not today, but perhaps tomorrow. So it would be fantastic if all the European curricula at least would have a certain package, mandatory, so that you get your credit at your end of your nurse studies, midwifery studies, doctor studies, and you say, I know what it is, a vaccine, I know how it is made of, what the composition is, what the programs are, and why we have to vaccinate. They should be the experts. Today, people don't recognize in a GP, in a nurse, or in a pharmacist the expert in vaccinology. And that's a pity. They go with their car to a garagist because that's the expert for the cars. We have exactly to do the same with our GPs, pharmacists, nurses, and midwives.
Sure, but when you've got a system that's almost ready to burst, you really have got, I mean, if I use the UK as an example, it's a basket case in the healthcare system. People are waiting nearly 8-9 months. 8-9 months for a follow-up or even getting an appointment to do something quite serious. And, you know, I'm sure it's the same in vast parts of Europe, right? And, you know, those of you in the private sector, you must be seeing this in terms of supply and demand of stuff. Where have you seen any of this good practice? Have you seen good practice anywhere where, you know, people are using pharmacies differently or have got a different kind of approach? Is it something that can be done locally, for example? Could a mayor make some of this happen? Or, not in the UK because mayors have no power, but here they do. Is it, where are the examples of good practice that could give us a bit of glimmer of hope? And where can it happen?
I think we don't have to look that far away. We did very well during COVID, but we forgot about that. Okay. How many pharmacists have been trained and have offered vaccines all over Europe? A lot. And they were very complementary to what was done by GPs, by vaccination centers. And that's only a way to reach 75%, 80%, and perhaps above. They are not competing with each other. In fact, they are covering different parts of that adult and elderly population. And if it is in a centralized system in terms of data, you perfectly can see, oh, this elderly person is already vaccinated. It's okay. I don't have to spend time into that person. Someone else did it already. And so indeed, within a community, you could agree that they work together, that they can at least guarantee a better health for a large part of their population. And I believe that bottom-up might work much better than top-down.
That's what I'm thinking. And I'll bring some of you in because you're saying, yes, it does happen, but I'll give you the mic in a minute. I want to ask you, please.
I just want to add, I think in UK we've done a really interesting study where you see there's a real difference in health equity. So for those vaccines that are available beyond the doctor's surgeries and the hospitals that are available in pharmacy, the people who are living in more relative poverty get much more access to those vaccines. So you can bring in the whole health equity argument as well. So pharmacies, you know, and I think I agree with everything you said. There's a real opportunity on the ground to get it right, not just from a policy.
In terms of free access, what are the economics of this from your perspective? Because, you know, I know about you're a producer, but you say, you know, let's make them freely available. Your views on that, how do we make sure it's free at the point of need? And that those who are in poverty, let's say you were to think about equity as a driver for access, Is it possible to make that happen? Give us your views on that.
So I just full caveat here, I'm not the expert in all the various countries in Europe and
Sure.
how that works. But in terms of from a pricing perspective, it's really important that we are making really high quality vaccines and that what's available is absolutely has the rigour that requires everything we have in medicines and vaccines. We fully consider in pricing the kind of socio-economic factors, and so we need to price at a level that enables us to not just bring out the next Me Too vaccine, but also bring something that has that additional value, that beyond standard of care. That's really important. So pricing has to take that into account. But where we see there are countries with lower income, we do have considerations of what that looks like within individual countries. And then if we look at the developing world as well, we work with global health to understand how we can provide access. So it's not a one-size-fits-all here, and it has to be done on a country-by-country basis.
Sure.
And that, I think that's half the problem as well. Every single country deals with providing access to vaccines in a very, very different way. And I think there was one country in Europe, but it did take 8 years to get even a paediatric vaccine onto the schedule.
Goodness me.
So it's not just the pricing, it's everything that goes around that.
But it is shocking, isn't it? I mean,
Yeah.
COVID's not. It's just over 3 years ago, and you just think,
Yeah.
my goodness, how can we collectively, globally forget what happened? It's just human psychology.
And I think just going back to your question, you said about monitoring, doing what we did with COVID. We knew people that had COVID, we knew people that were being vaccinated. How do we take advantage of the structure that was put around then to be able to monitor this? Because there is a real opportunity for us to ensure that 75% of people are getting vaccinated. If we don't have the data, it's going to be incredibly hard. And so what have people done? Have we just put that all aside?
I know, but that's the other bizarre thing. We knew that somehow there was a system in place that if I travelled from London to Brussels, I got a thing on my phone. So there's data everywhere. So there's a system that's either been made dormant or it's still there, but that infrastructure must be there, surely. Do you want to say something about that, Pierre?
No, and I agree. We could do much more during COVID-19, and after, suddenly they say, oh, GDPR, we can't do that anymore, which is crazy. We did it. During 2 years, we were able to connect databases. They were compatible with each other, and now suddenly it doesn't work anymore. So I can't explain that to the, I would say, average European citizen. I'm sorry. So we have to work on that and to improve it and to explain how we can do it, not how we can't do it. And perhaps I was also thinking on your comment, one group we should not forget, and also in the report of the München Board on Vaccination in Europe, they refer to that, is the occupational health department. Because we don't vaccinate anymore since after school, and then we try to convince people above 65 to be vaccinated. And in between, we do nothing.
Exactly.
And I think, again, there is a huge role that occupational health department should play.
Absolutely.
And it's a kind of repetition. And the better you can change the attitude of someone is repetitive. That's how we have been educated.
Absolutely. Yeah. Habit forming, that's the thing, isn't it? We need to form better habits. Thank you. Let's move on. I want to bring in Peggy. Peggy, you've been very, very patient. And I hope you found this conversation provocative, thoughtful, and interesting. I want to bring you in the sense of building on everything that's been said so far, especially by Pierre, that we know that across the world, that women carry a different burden of responsibility depending on political, geographic, socioeconomic circumstances, right? And often have to be both the carer and the provider, but also the person that makes sure there's good health is ensured. Give us your kind of perspective in terms of how do we ensure a gender positive approach to this discussion?
Okay. Well, good morning, everybody, from a very sunny Dublin, and happy International Older People's Day. And today is International Older People's Day, so very timely meeting.
Indeed.
But as you said, one of the biggest challenges facing Europe today is maintaining health across the lifespan. I think Mr. Andriukaitis was talking about that, particularly in light of the ageing population. And the fact that people are living longer is an achievement in itself, so it should be celebrated. And in fact, vaccination has contributed to the longer life expectancy, and that's always forgotten, the eradication of smallpox and hopefully the eradication opportunities in eradicating cervical cancer. And vaccination, the evidence there provides cost-effective protection against a number of diseases throughout a woman's life, like cervical cancer, yet it remains underused in public health strategy for the promotion of healthy ageing. And healthy ageing has to be a priority on the health and social agenda in the next mandate, and hopefully that'll happen. And because Europe has the highest proportion of older women in the world, and we're on the forefront of ageing. So apart from the biological aspects where there's differences in immunology for men and women, there's also the social aspects as well, where women are living longer, but there are multiple roles and societal roles, and the lower financial resources also affect their access to health services, and particularly things like vaccination. And I think it was mentioned before, there's a lack of awareness, there's a lack of joined up thinking when getting the messages out there and communicating the benefits of immunisation. And there's a lack of awareness for women themselves around what the issues are around vaccination, particularly older women. They don't understand the risk. It hasn't been explained to them on an ongoing basis. And they think they're probably immune from getting any kind of infectious diseases. But the problem is that a lot of older women have comorbidities, and therefore they need to be coached along and spoken to about what the risks are. Also, when talking about AMR, the person brought up AMR, there's very little discussion on the use of vaccines in reducing antimicrobial resistance. It's a huge issue. That's something that has to be done. So an uptake by women of vaccinations such as influenza and shingles and pneumococcal vaccinations are influenced by the culture and where they're living and what they're earning, and also what the comorbidities are. And also they're also involved in being targeted by the anti-vaccination lobby with negative information on vaccination, and this doesn't help. And also the effectiveness despite robust evidence. So there's a huge issue on trust still, and even though it wasn't there at the beginning of COVID, it has come around again, and it has to be addressed. So the opportunities across the life course to provide positive information on vaccination, there are certain times when you can intervene positively, when people are open to hearing messages. And I'm talking about around pregnancy, for example, and also around menopause, and when women are going into an area where they may be at risk of heart disease, osteoporosis, etc. So there are opportunities that are being missed, I think, in public health, that we can get messages to women and also to their families as well. And also, I think, in Europe, at a European level, the Brussels bubble has a huge number of chronic disease patient organisations who are members of the health policy platform. This has been established by the Commission. And chronic disease patient organisations focus on the best treatment and care for their patients, but they're not always aware of the interaction between chronic disease and infectious diseases. And patients must understand that bacterial and viral injections can worsen pre-existing chronic diseases. So shielding older and vulnerable people with chronic disease from further infection can prevent, as we said before, unneeded hospital care and reduce the burden. And for example, patients with asthma and respiratory disease are at an elevated risk of contracting pneumonia. So there's an opportunity there to gather all the stakeholders who are involved in single issues, for example, like heart disease or AIDS or diabetes, to work together with them to raise awareness on the issue of vaccination and how it can help their constituent groups. And also, as you mentioned as well, women are the main carers of children and ageing parents, and they are more likely to recognise the importance of preventing disease. So they're an obvious group for public health experts to engage in meaningful dialogue about vaccination across the life course. And inclusive targeting strategies involving women themselves. And I think it's important when developing messaging or looking at what the issues are and barriers to actually hear the voice of women, that what are the barriers, how can we address them, and what are your fears, and what do you need from an information perspective. And I think the health authorities at national level need to know this. I know an example of that is we held a workshop on vaccination and where you get your information from. And we invited the National Authority along, the Immunisation Centre. And I think they were fascinated with being involved with people themselves across geographic location and ages, and listen to what information they needed and what they wanted, so that they would trust in the information and what information they need. So I think there's a lack of collaboration there, a lack of joined up thinking, and a lack of communication with each other when it comes to promoting vaccination. And addressing barriers that women might face, such as mobility issues or socioeconomic constraints. And I think, as Pierre said, we need to go to places where older women are actually working and living in local centres, pharmacies, for example. I mean, I think the pharmacies are underused, so that we can make sure that we get to people on the ground, that the ordinary person on the ground. So I think by focusing on women specifically, I think there are opportunities there to address health disparities resulting from lack of information, from social, economic or cultural factors, and that's ensuring that women get equitable care and attention when it comes to vaccination. So I'll leave it there at the moment.
And so I'm interested in the fact that you're the European Institute of Women's Health, right? Where are you seeing moments or examples of good practice where we might be able to learn from? Where do you see, because if we see good practice happening, then we can try to understand what is giving rise to that and how that can be replicated elsewhere, or what are the conditions that are being created to create that good practice. Are there any examples you can share with us of taking, let's say, a pro-women led health agenda that's, really making this work?
Yeah, I remember we were a member of the ECDC working group on vaccination, and I remember being at a meeting of ECDC and saw some really good models of good practice, and one was on cervical cancer prevention, and it actually involved the women themselves and someone who actually had cervical cancer and hadn't had the vaccine. And she was really promoting the use of the vaccine and how it, really must be, the awareness on this vaccine must be put out there. Another was on pregnancy, where there was a real focus on pertussin and influenza during pregnancy. And I think, again, it was pregnant women and, the needs that they needed to make sure that they had a healthy child. And the interesting thing is, I think data, and I think it came from the ECDC afterwards, showed that the women who are involved on taking the vaccines for pertussins and influenza during pregnancy also more likely to use vaccination or get their children vaccinated as well. But I think Pierre brought up an interesting topic, and I think this the Institute would very much endorse this as well, and I think Susan brought it up as well, is the lack of data. We had it during COVID, but now there is a lack of data, and I think we need to gather the reset, the data, and women have started not been included, for example, in clinical trials. This is from a biological perspective, so that has to be strengthened. But we also need to gather data on the health status and immunisation needs of women across the life course, and particularly at older ages. This is what this workshop is about. And considering factors like comorbidities, access to health services, and also from a poverty perspective as well, are they able to access it? And change the narrative on ageing. I think this is the most important thing as well. Change the narrative on ageing, and also bring in more health promotion and well-being and messaging, and include vaccination as part of positive health and well-being messages. And I think, as Susan said, only 3% of GDP is still being used, or GMP is being used on prevention. And I think really, I think the Commission and Member States really have to get together and look at this very, 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 very strongly. Change the narrative. Let's get more positive about health and well-being into old age. Women and men are living longer, probably going to be working longer as well in the future. So I think it behoves now the new mandate in Parliament and the new Commission to really focus in on health promotion and well-being, because healthy people are healthy economies. And I think maybe something's been forgotten about that. So really that needs to be brought in again into the conversation, and use diverse communication channels, but involve the women, involve older people themselves in designing the messages. First of all, find out what their needs are, and then work with them to design messaging that will get out there, and use organisations like Age Platform, who have memberships in all the member states and do fantastic work for older people. Use the organisations and the NGOs who are working on specific disease areas, and the healthcare professionals, the nurses and the pharmacists. Bring everybody together to find out exactly how, from a societal perspective, how we could all work together to improve older people's health.
Peggy, absolutely right. No, yes, absolutely. But what it kind of reinforces is that when adversity strikes, human nature swings into action and does amazing things. But then we have the incredible short memory that we think it's never going to happen again. And the things you describe are so common that we know this. Our generation, I'm old, so we know from my experience that some of the things you're saying are absolute common sense, but it's politics that gets in the way of making that shift. And that's why I think that dialogue of how do you take a bottom-up approach to this? And rather than waiting for pearls of wisdom or money to come from the top, there's something about community self-organisation on health that we might want to think about building on what you were saying, and and I think that could also include the private sector. You could be very local in your intervention as well. Okay, so what are you thinking? What's your reaction to what you've heard so far? Any violent objections? Any ideas? Gentleman there.
Thank you. I am Enrique Terol. I am from the Spanish Permanent Representation.
Yes.
And I would like to raise an issue that, from the perspective of my country. For example, in Spain, we have a strong primary healthcare system that it's universal, free of charge. Vaccines all of the vaccines are included in the calendar are free of charge. But we have a coverage of influenza in elderly people, above 65, less than 60%. Even in people with vulnerable with morbidities like cardiovascular disease, chronic bronchial disease, etc., the average of coverage is below 70%. And then the question here is, okay, we have, in principle, it seems that we have a good offer. How we can create the demand of the population to go to the system to get vaccinated. So, of course, we have to improve how we are offering vaccines. It should be easy, should be something that you don't need to have a bureaucratic process to have ask for an appointment, etc., etc. It has been raised that all the players in healthcare should be involved. Nurses, of course, pharmacists, but many other healthcare professionals. But I have the impression that we are having some kind of incapacity to develop innovation in reaching out to the population. And then the question is how we can do it, because in other areas, so this type of communication specialists or experts are doing it very well. You can create a demand on things that are completely incredible, but we are not able to create this demand when it's related with the health of the population, with your own health. What do you think? Is there a way to involve the communication people, the media, the social media, of course, to help to this task?
I think you gave already the answer. In COVID time, I got a message on my phone. And I think most of this population has a cell phone, a mobile. They get a message, to have their dog vaccinated. They don't get a message to have themselves vaccinated. They get a message from the dentist to go to the dentist. They don't get a message from the pharmacist or from the nurse or from the GP to get their vaccine. So it's very clear. We don't do this. I don't know why. GDPR? No, I'm joking. No, but I think we have to change, really, to have a mind shift there, because we can do it. We have the tools, the innovative tools we use for other purposes. But in addition to that, and I continue to say it, if some of these elderly people ask their doctor, what would you do in my case? Some of them would say, I don't know. And that's wrong. They should be able to say, look, you have that age, you have that comorbidity, it's clear you need extra protection. And it's up still to the person, to the patient to decide. But at least he receives or she receives a clear message, a clear recommendation.
I think, just to add on to that, I agree with that. I think you mentioned it previously, it's the awareness, once you get that ping on your phone, what that actually means, why it's important. Do you understand what the consequences are of the disease? If you don't get the vaccine, which could not just be a stay in hospital, it could mean a heart attack or a stroke, because we know that there's massive risk in older adults to have complications. And to your point, education of the healthcare sector, and I think that is a partnership across the private sector, NGOs, the healthcare environment, the policy makers. I think, certainly we educate in the private sector. There's always the conspiracy around the motivations of the private sector. I feel very confident that what we do is the right thing, but it's not going to work. And even those even that technology is not going to work unless we have consolidated education in terms of what it means and why it's important.
But you know, education is not a mandate of countries.
No.
It's a mandate of Europe. So Europe could do a lot here.
Sorry, but education is in the hands of member states.
No, I think you know what he meant. It's a different thing.
I fully agree with you that I am not so optimistic about possibility there is demand, because, we have limits, of course. I think now we have strange definition, post-trust society. Mm-hmm. People do not trust in science. Can you imagine? I raise questions about why, how we can address such phenomena, because distrust is going. And a lot, some now argue that the Earth is flatter, and they're trying to believe in it. Mm. You have no chance. Believe me, I spent a lot of hours debating with all different people. We organized citizens' dialogue with all 27 member states. You remember, you were together with us. And it was so interesting time to see, to listen. And sometimes you have no chance to address because you think, oh, mamma mia, it's stupidity around you. I proposed to Pasteur Institute, are you capable to develop vaccine against stupidity? But it is not impossible. But, I also give, when I joke, I provide example. You remember, lumpy skin disease was. And we decided to vaccinate cows, in Croatia, in Slovenia, in Bulgaria. We vaccinated all cows. And no one cow was against vaccination. Cow is much clever compared to some actors in our societies. I am joking, but of course also, please keep in mind that vaccination was the beginning from time of Jenner. How many argued against him? You remember the story? It was so difficult to defend him that it's really workable. You remember time of Jenner time? It's the same. We remain in the same situation with a phenomenon of trust. I don't know how, but communication is really a very difficult question. It's difficult. And of course, it's not so easy to say. And please look, we remember we organized vaccine summit, a global vaccine summit. And we used examples. One girl who died, but she delivered her, message through the Zoom after she died because of human papillomavirus, because of cervical cancer, And this message was so powerful, and we received a lot of millions of reactions. It means that we need to use also not only scientific, but emotional. I don't know how can we do it, but we need to use those emotional also aspects to showing, how it is painful if you see in your own environment also difficult consequences.
Thank you. You lot are a bit quiet at the back. Excellent. So I'm going to err on the side of someone who hasn't spoken, then come back to you, sir.
Hello, can you hear me? Great. Georgios Mordindrakis from RPP Group Public Affairs, and I will build on the previous question a bit. We saw that von der Leyen, she proposed a portfolio on intergenerational fairness that was attributed to Malta, and I would like to ask if we can leverage this portfolio to promote a more intergenerational approach on health and how it can help tackle these barriers of ageism and gender inequalities.
What's your view?
It's a difficult question, and I believe it will be. It can be a good opportunity also to give this intergenerational approach to healthcare, and if they collaborate good with the health commissioner, whoever this is, it could be a good opportunity to have a more holistic approach to disease prevention and health promotion.
Okay.
But this is my view.
All right. Any of you on these two tables, especially the women, any views? Excellent. Thank you.
I do.
Do introduce yourself, please.
Okay, my name is Jurgita Kaminskaite. I am from HDE, Health and Digital Executive Agency. And I just wanted to compliment Mr. Andriukaitis. It's extremely difficult to combat hesitancy. So you can create some videos, what was done by ECDC concerning measles. Most people might know about one case was this ended happily. Girl recovered. Another less successful was, but anti-vaxxers would manage not to see, to leave the room because of some other reasons, and they are very loud. And somehow, if you look to media, they are dominating. And I have no idea, but this is most biggest obstacle to convince hesitant anti-vaxxers. And some of them might realize, but as was mentioned by Mr. Andriukaitis, it's too late. I mean, people, last days of their life, they realize how big was their mistake, but no way to rectify mistake. Thank you.
Indeed. Do you want to? Excellent. Let's.
I want to come in the discussion on hesitancy because I'm a colleague of Pierre van Dam, or Pierre van Dam is my boss.
Yeah. Okay. But, your name.
My name is Grit Hendricks, and we have the Center of Evaluation of. I'm working for the Center of Evaluation of Vaccination, but we also have the Vaccine Confidence Project in our team, and I wanted to come back on the hesitancy. Because a lot of people are blaming hesitancy as the most factor to influence the uptake of vaccines. But we have to be very careful because in the COVID period, the amount of really anti-vaxxers, people who say no to all vaccines, is in fact very low. It's not a big amount of people. They are very loud, that's true, but it's not a big group. But what is important to mention is that there are a lot of people who have questions on vaccines. They have questions, but these are not anti-vaxxers. They question the vaccine. And there, Pierre already mentioned that a lot of these people don't get answers anymore because they are immediately put in the part of the anti-vaxxers. So a lot of people, even a lot of parents, elderly people, they have a lot of questions, and their most trustful source, it seems, it's the healthcare provider. So it's really our task to train this healthcare provider to answer this question.
But also that point that if you want to really democratize the ease of access, pharmacists and other healthcare, community-based contexts that, or whether it's a community facility, if you could get the information out more readily out there and almost have supervised access to vaccination care and understanding, we could, do far much more.
But there are low-hanging fruits. You have in a lot of practices of GPs, you now have nurses. These nurses, they have really an influence. They are the ones that they are contacting when they are getting their flu vaccine. These are the people who are giving this flu vaccine.
Indeed.
And they can answer their questions, and these people we need to train.
Absolutely. On the point of nurses, you had your hand up first, and I've now come back to you. Mike's on its way.
Well, it's just a short comment. I'm really pleased to see Peggy McGuire. It has been a while since you had this big event, maybe 10 years ago, and it was a very great presentation also on women and vaccination. So I also thought maybe just to bring in the midwives. But all these presentations, all what you say, it makes sense. You learn a lot. And coming back on your point, what we do, for example, if you're talking about biosimilars, a lot of people who are using their originer and they have to switch to the biosimilar, there are a lot of hesitancy. So what we did, we made a guide, but made it translate by the nurses by the country. So the Portuguese nurses translated our guide, and that created a lot of dynamics. So I think we should learn a lot from good examples and exchange.
Great. Thank you. Thank you very much. We're in the kind of last 7 minutes or so. Peggy, any final thoughts from you before I work my way through the panelists who are in person.
Nice to hear Bear again. Hello, Bear. Nice to I can't see you, but hello again. Yeah, just listening. I mean, I think one of the speakers who worked in the evaluation centre talked about the hesitancy, and I think she made a very good point. I think it has to be made again. That research shows that healthcare providers are the #1 source of trusted information. So I think there is one target, to all the healthcare professionals together. To make sure that they are giving out the messages there on vaccination, because I don't think it's happening at the moment. And just from our own experience as with this workshop, they're not giving out the information. So I think that's one area. And I think, there's an opportunities there, I know, with the EU for Health programme. I mean, it's the one mandate the Commission have is health promotion and disease prevention. And maybe we should look at that collectively as all stakeholders to exchange good practice, to make sure that we're getting information out there. And I think the ECDC does have a role as well, because it is dealing with member states all the time. So what can they do to work with us, with the Commission, EU for Health programme, the healthcare professions, etc., working together collectively? I think we can make a difference, but it has to be collectively, I think.
Yeah, I suppose the issue is whether it's a top-down or bottom-up, or is it both? But there is something about what we've spoken about, that time's gone to waiting for let's say, the politicians and budget holders to shift things. There is so much power in community DIY. I'm a real believer in that, and I think I've seen it myself. But you need to create some sort of momentum. And it's institutions like yourselves and others here that can really, I suppose, power the elbow of a local pharmacist, a local GP, getting in touch with the local arm of GSK or others to really create a community-based approach to healthcare prevention. Thank you, Peg. I'm going to go back to you, Pierre, and then any last comments from you?
Any last comment? In fact, people know that, but I don't like healthy aging. I like healthy longevity, which is much more positive, optimistic, and that's really what we want, is to have that large proportion of our population to live longer and healthier.
Absolutely, you're absolutely right. And we were having this conversation, Susie, you and I, about that, and there's been this research done, and maybe a foresight analysis by the European Commission about the fact that we're likely to see those who retire at 60, 65 are going to still be, okay until they're 80, 95. So we've got a different life trajectory post retirement. So societally, our mind shift is going to have to be significant, because most people may not want to just be at home, want to do something else. And we're going to have to really rethink how we deal with longevity, because it's on our doorstep right now. Sir?
Okay, my last remark is very simple. Easy access, equity, easy awareness campaign, friendly environment, healthy longevity, all those components should be on our tables, and to see how can we promote life course immunization, because it is easy, it is safe, and it is true and based on science and based on our belief that it would be much better to stay as long as possible, as good in health as possible. Thank you.
Thank you. Susie?
So you've just helped me with a nice segue on life course and immunisation. I think let's talk about it more, but be very specific what it means. It is paediatrics, it is older adults, but it's also teenagers when they go to college with the meningitis vaccines, with the HPV vaccine. So normalise vaccination as life course. And I'm just going to briefly put my GP hat on. My last role in the UK's NHS was as a GP, so general practitioner. By definition, we're generalists. We're the experts in not being the experts. And I would love to get to a point with healthcare primary care services where we are not reactive gatekeepers. As you said, the UK NHS is a basket case. I'm not sure about the rest of the Europe. I suspect there's some similar organisations, but we need to be able to allow general practitioners and the nurses and the allied healthcare professionals to be able to think about well-being versus treating the sick people that comes in, that would change the course of everything we do. And I realise that's the North Star, but it's not just about educating on vaccines and getting the infrastructure for vaccines, but we've got to get our healthcare environments into a better state to enable that. So that's my last thing. But I have to say, I'm delighted that this is on the agenda. And I think there's a real responsibility now, not just an opportunity for us all to work together.
Thank you very much. Thank you very much indeed. I mean, colleagues, the one thing that feels through this debate is the sense that we are powerless and we cannot change the system. It kind of comes through as a kind of ricochet that we're not learning lessons from the most significant pandemic and health crisis that any of us in a generation have experienced. Yet we seem to have forgotten the lessons from it. But two little bits of data: 35,000 people are dying every year from AMR. 35,000 people, in Europe. We don't talk about that. And 0.2% of national budgets are spent on immunisation. 0.2% on immunisation. When, if you think about it, if you tip that on its head, the budgets that would be available to do the right thing would be there within a space of 5 years. And so on that depressive tone, I think that let's imagine, the challenge for us, there's a very famous anthropologist, and she said, don't underestimate what a small group of people can do. It has been ever thus, that you only need a small group of people to change things. And all I'd say that as we try and reimagine health, don't forget that the GP, the association, the pharmacy online, she's gone, but the others in you that are doing or involved in these matters could really take a bottom-up approach. It only needs 5 or 6 people in a locality to make change happen. So on that positive note, thank you very much. Thank our speakers in the usual way. Thank you very much, and you, Peggy, online. Have this. You have a leaflet on your table. These are our 10 policy choices for a renewed social contract. This is what we're promoting with the European Commission right now in this new mandate, a set of choices that we think will make a fairer, more just transition. And there's also the yellow ones, which are about, we spoke to 2,024 citizens across Europe to give you a flavour of what people are thinking. Thank you all very much, and keep an eye on our website for our next instalment. Take care. Thank you very much.